So good day. Today we will be talking about the postpartum assessment on human science. So before we're going to start, let's talk about the bubble heat technique. So bubble heat technique is an acronym used to denote the components of the postpartum maternal nursing assessment. This method also enhances to stand the physical assessment process typically performed on hospitalized patients by the registered nurse, such as those on a medical surgical floor. For stable patients, vital signs are taken every 15 minutes during the first hour following delivery and then gradually less frequently. While performing the bubble heat technique, the registered nurse often uses the assessment time to provide for patient's education. So the bubble heat acronym stands for breast, B for breast, U for uterus, B for bladder, B for bowels, and L for lucha, and H for humans, and E is episiotomy and perineum. So now, I assign in the postpartum assessment focusing in the human size. Before we're going to proceed in our specific topic, we will be talk about the objective of this presentation. By the end of this presentation, we'll be able to understand that what the postpartum human signs and the signs and symptoms also, and the nursing care of the postpartum who have a human signs. The areas of emphasis during assessment. Then after that, the definition of the human sense is a superficial thrombophlebitis that is commonly prevalent during the postpartum period, that during pregnancy and is seen more in women experiencing varices. Postpartum deep vein thrombosis or DVT is also a superficial thrombophlebitis have been attributed to a trauma to the pelvic veins from the pressure exerted by the presenting fetal part, impaired circulation caused by mechanical edema, and also the changes in coagulations related to the high amount of the estrogen that produced during the pregnancy. So that involves only the superficial veins that on the leg or tight is unlikely to result in pulmonary emboli or the PE, while approximately 50% of clients with DVT are asymptomatic, is more serious in terms of the potential complications such as pulmonary embolism, post-thrombotic syndrome, and also the chronic venous inefficiency and the vein valve destructions. So, human science is a screening test used to check for the deep vein and also deep vein thrombosis, which is the DVT of the calf. It's sometimes called a dorsiflexion sign. It was first described by John Humans in 1941, who was an American surgeon. Then, in maternal examination of legs, we do a human science test to detect the early DVT that assess for a signs of DVT of asymmetric, the size, the color, or the temperature also. It also assess for signs of superficial thrombicitis or redness, warmth, tenderness, pain, that limp or darkening of skin over the hardening of the vein. And also in postpartum assessment, in assessing on human signs, assess for signs of DVT by the human is a positive sign is indicative of DVT. Although it's not the most reliable indicator, but all of the characteristic changes to the maternal clothing factors are higher than any other point as the body prepares for a labor. It also combined with being in bed, with being in bed, especially if the mom underwent a C-section, and it's easy to see why the postpartum woman is such as a huge rest of DVT. So in performing the woman signs, most commonly performed with the mom is in a supine position while lying in the bed. Have a mom have a mom lie on the bed, her back and bed and extend her legs out straight. Then also place your hands on the balls of the feet, then flex upward and the ankle. So be gentle and don't overflex. Then complaints of calf pain in response of a positive human sense and further exam should be done to rule out of the thrombosis in the legs. The the calf is also flexed in a 90-degree angle. The nurse manipulates the foot in a dorsiflexion movement. If pain is felt in the calf, the human signs is said to be E positive. So there are signs of a DVT. A sudden and unexplainable pain is usually in the back of the leg or the calf, which is here. So the tachycardia and the shortness of breath or dyspnea from decreased oxygenation status. Also, the signs is of DVT are edema, the redness and the warm localized over the area of the DVT from the vascular build up around the clot. So in the human scientist purpose is a test that commonly known as a physical examination in the presence of additional clinical symptoms. A positive human test may be fast warning. Although clinical evaluation almost cannot be dependent on the for the patient's treatment, it can be beneficial in evaluating the need for the further testing such as the Dahmer test or ultrasonography. So, and preventing the DPT, which also dangle at the sides of the bed within 6 hours, and also stand up within 8 hours to prevent the DVT and also encourage the ambulations at first and independent walking when ready. There are potential complications of a DVT. A pulmonary embolism, the PE, occurs with a clot breaks away from the leg area and travels to the lungs. And the PE is a medical emergency. You should call a doctor. So there are a technique in performing this test. The patient will need to actively extend his knee. Once the knee is extended, the examiner raises the patient's straight leg to 10 degrees, then passively abruptly dorsiflex the foot, and squeeze the calf with the other hand. The deep calf palm and the tenderness may indicate the presence of the DVT. So there are sensitivity and specificity of the human signs. A low sensitivity and the specificity in diagnostic. It can be of a value of use in addition to more accurate diagnostic procedure like ultrasonography and the venography. So notes, if the calf pain with the knee extended can also be caused by intervertebral disc or a disease that radicular symptoms or a muscle contractures that performs of the test may increase the risk of producing a pulmonary embolism. So that's all of my report of about a human science. So there are a there this is the reference of my topic, the human science. Thank you.